Welcome to the 6th annual Parent Network Workshop. Right now you're joining us for the session, Improving Conditions for Learning, including social emotional learning in our schools. And we are excited today to be joined by Sammy Edge, our reporter from the Idaho Education News, Dr. Eric Studebaker, the Director of Student Engagement and Safety Coordination from the Idaho State Department of Education. And I will get to join you today, and I am a parent and part of the Idaho Parent Network. So today in this session, we are going to do a lot of things. Coming up with our learning objectives was hard because there's so much to go over, but we're going to become familiar with the process used to create the current recommendations that the State Department of Ed is looking at, and also understand how the recommendations and activities will lead to behavioral health and wellness services in Idaho schools. So with that, then we're going to just get started. I would like Dr. Studebaker to kind of take it from there.
Thank you, Laura. Well, I wanted to start this presentation out and give folks some background to how we got to where we are today. And so the first few slides are going to talk about a survey that we conducted last fall, in the fall of 2020. We presented this information to the legislature last legislative session, and really it started to lay the groundwork for the work that we've done over the last year. And we'll get to that as we go through this. But do you want me to say next slide?
No, I'm good.
You're good?
Gotcha.
Okay. So this survey, the legislature directed the State Department of Education to conduct a behavioral health and wellness survey of the resources and supports in our schools and districts. And so the survey was asked to district administrators and school level or building level administrators. And then there were folks in the survey who served in both roles. The note at the bottom of this screen is, as we get into other samples or other responses, you may see that the totals don't always add up to 100%, just because we didn't have 100% participation on all of the survey questions, but we did include them where we could. So a little bit about who we surveyed. One of the big questions we asked in this survey, and this survey is available, and I'm going to kind of give you the highlights here. If you want the full survey, there is some more questions that we asked, but we're going to just highlight kind of the main questions. The first one was to the districts: what approach do you have or do you use in your district to support behavioral health and wellness services? And PBIS, or positive behavioral interventions and supports, social emotional learning, and trauma-informed practices were the highest responses, with a mix of a variety of other approaches throughout our districts. Next, we asked how they implemented their approaches. And the districts said, by and large, the biggest response was that they did this through professional development. Some districts have employees who were dedicated on behavioral health and wellness. Some have teams. Others provide funding to support programs and services within the schools, and others partner with outside providers. Policies and procedures related to behavioral health and wellness was at 42%. The interesting thing to me about these numbers, when you look at them, is that I kind of look at what's not being presented. So we see that 42% of the districts said they had policies and procedures to support behavioral health and wellness services, which to me also then says 58% of districts that participated in the survey did not identify as having policies and procedures in place. So as you look through these various data points, that is something to keep in mind.
And it definitely, to me, I appreciate you pointing out that, 42% means 58 on the other side. And that, districts providing professional development, 65% says great, but it doesn't tell us professional development to who. And so it just says that it happened. So while it's a great number, I think going forward, we just need to know who's getting said training so that we know, we know what that means to the people who actually interact with our students.
And, to that end, Laura, I do want to say this survey was done in collaboration with Education Northwest. And it was really limited by funding, really. So the amount of questions, the depth of questions was definitely impacted by funding. And we definitely could have gone deeper, I think, given more time and funding, as we will see is often a problem.
Well, I think the good news is that just something that we know to ask in the future. It's something to keep track of down the road and make sure that those numbers are in the right direction.
Absolutely. Next, we asked about the services districts offer. And what we see is the district has strategies or practices that we implement for all students. Again, 59% here said they do. Similarly, districts say they have lessons or strategies available for use by employees, so resources for employees. They also, about the same, responded that they encourage employees and students to learn about behavioral health. As far as structured programs or curriculum that they implement for all students, you see just 27% of the respondents said they do. As far as providing nothing, just 9%. So that was nice to see that a lot of our schools are at least addressing this in some way, shape, or form. How are they measured? This was really interesting. What we saw in the survey was a lack of formal evaluation of these programs by and large. And when they were evaluated, they were using varied resources or data sets. So including behavioral data reviews, student surveys, classroom observations, suspension, expulsion, academic data, attendance data. These are often very common metrics to evaluate the effectiveness of behavioral health and wellness services in schools. But it also only tells a portion of the story. And so Laura, if you don't mind, you provided me some feedback on this and I appreciated that. So I'm gonna see if you'll share that with us again.
All of these data points are needs-based. None of them are strengths-based. So it's really easy to make your suspension and expulsion data look better if you stop suspending and expelling people. But that doesn't mean that you actually replaced it with what you want. You just stopped doing the thing that looked or reported poorly. And so I think as we move forward, the conversation needs to focus more about the strengths that we're building as opposed to the needs that we see disappearing. I'd like us to be excited about reporting our data because we're reporting strengths.
And I think that's a great comment. We in our state have districts who are not involved in this work, and we have districts who have been involved in this work for 20 plus years. And so when a district initially implements, you may see a change in some of these data points, such as attendance or suspension and expulsion, but over time that will plateau. And that doesn't mean the programs aren't effective. It just means they're not showing up in that data. And so to Laura's point, I think that's really good, especially for those districts as they move towards sustaining this and kind of creating a culture that supports behavioral health and wellness. Those positive impacts are going to be more important to track for sure.
So my daughter's district just implemented a pilot program at her high school where because they have, a slightly different school schedule this year with COVID changes and everything to their class time, they have mentoring Mondays. And they have an entire class period once a week where the students are in a classroom with the entire intention of getting to know a teacher who is not normally on their cycle of classes. It's not a teacher that they normally have. And the intent is to build a relationship with more adults where they are checking in. How you doing? How's your class load? Anything else going on? You struggling with anything good happening, anything bad happening? And they have to have personal one-on-one conversations scheduled with them once at least, hopefully every 2 weeks, but hopefully every three, minimum of every 3, where they can bring situations to them and say, hey, I'm struggling here, or this is going really well, and they're problem solving with a faculty member basically in real time, and they have someone, if something's not going well, they can immediately check in. So I looked at that program and I looked at this data we collected here, and I look at it and think that school is going to have different types of questions they can ask that are more strengths based. Things like, what percentage of your kids are checking in weekly or biweekly with, a faculty member who, how many of them are bringing concerns to you? How many, and that kind of data, I think, is going to eventually show us where we're making progress here. But until you have something to report strengths-based, it's hard to report it. So, but anyway, I just thought about that when I saw these numbers. I'm like, that kind of pilot program is going to have very different types of things to talk about.
And Dr. Studebaker, if I could jump in here for a second, I think it's important for parents listening to realize that in a very local control state like Idaho, it's optional. It's up to the districts whether they provide mental health supports to students, whether they incorporate social emotional learning. That's very much district by district decision making at this point, which is kind of why, as you mentioned earlier, we see districts that are not engaged in this work, and we see districts that have been doing this for 2 decades because they think it's really important.
It's a great point. And to that end, so is how they evaluate. So if they do something, how they evaluate that work is up to that local district. And so as this conversation moves us closer to talking about our work plan at the SDE, I think now's a good time to point out that this work plan is not for the schools or the districts across the state. The work plan is focused on how the State Department of Education can best support our schools, given the variety of services and supports they provide. So keep that in mind as we get to that work plan. We're almost done with reviewing some of this data on this survey, but this was a big one and not surprising, but what are the barriers? And clearly the top 2 were lack of adequate time and funding. One of the barriers that was interesting was that rural districts did mention that access to service providers was a greater challenge for those schools than their urban or more urban counterparts.
It's not surprising.
Yeah, we're definitely having a challenge with access to services in pockets of our state. And even with increase in demand, we're seeing access to services increasingly becoming difficult even in our more populous areas. So Sammy, I think you were going to jump in and say something.
Yeah, I was just going to mention, when you talk about the ways that districts evaluate these services, earlier this year, I went through and talked to a bunch of districts doing this work, and that was one of my central questions for them. And I think really what it comes down to is when there's not necessarily a mandate to report their evaluations of this work, creating a comprehensive evaluation system takes a lot of money and takes a lot of time. So often when districts were doing this work, it was that evaluation piece that was missing because it's so work intensive.
So
I agree, Sammy. I agree. I mean, if you have to decide between spending the dollars on doing the thing or reporting on the thing, I think we all agree doing the thing is more important. But how do you improve the thing? Whatever your current widget is, it comes down to what you know about how it came out. And I think it's a natural process that, you start and then you go, wait a minute, we don't know how well that worked. We need to evaluate it. But if there's only so many beans in the pot, you use them for doing the thing before you use it for reporting on the thing.
Right.
Yeah, I agree. So on the impact, what we do see is pretty strong agreement. The right and kind of middle column that are purple and in that bluer color show that for all but 3 of the items, we have 95% agreement that behavioral health and wellness services help students feel safe and supported and ready to engage in learning. They help teachers and staff build stronger relationships with students. It helps students build stronger relationships with peers. It promotes better academic achievement. It builds student engagement. All of these things there was high agreement with. Where we started to move away from 95% agreement is when we ask questions like, are these services and resources available to all of your students? Or are these resources implemented across your entire district? That's when we start to see some discrepancy in the response. But I thought this was a really great slide just because it's very rare to see a 95% agreement in a survey. And across the board, we saw that on the impacts, positive impacts of providing behavioral health and wellness in our schools.
And I think it's important to note that when it says, are they available to all schools or all throughout the district? And the answer, when it starts becoming no, sometimes we do have districts that that focus these programs on certain groups of kids, whether they have special needs and they're in a self-contained or a special setting, or they have special supports that they are using for that, or kids who have been identified as having needs of some variety. And they focus those kids and those programs and sometimes group them together in schools, especially when you have limited resources in your district and you're trying to maximize your effectiveness for your dollar spent. And to me, if your kid happens to be one of those kids in that program, woohoo, you have access. But for the rest of the kids, that is something that is a reality in Idaho. How do we spend our resources? But it's also important for us to know that it's not everywhere. I think a lot of parents think, well, that's happening everywhere. It isn't. A lot of districts do amazing work with what they have, but it's just not everywhere all the time. So I think part of what we're looking at going forward is how do we help improve that access through the supports that we need to give schools and districts, and helping them, like what Sammy said, with some frameworks if they're not doing all the legwork to, that they have some structure in place. So I'm excited with the data you're showing us, because it's telling us that we have a lot of agreement that this is a needed and an important thing. And that's a great place to start when you're having a conversation with an entire state at the same time.
And that is a great transition to our next step. After collecting the data, we wanted to move into, well, what does this data tell us, and how can we improve the system to ensure that our students, families, and educators have access to those resources and can connect families and students with resources. So it was in...
Oh, my slide decided it doesn't like having... Oh, there it goes. It's because it's automated. Oh, who knew?
We decided some of the initial steps we wanted to work towards were collaboratively defining a vision statement on serving the whole child in our state, establishing some consensus around terminology. One of the things, if you have followed this area of service for a while, is the variety of terminology that's been used, not just currently, but also historically, to address this issue. And so you see a list of those different terms that are common in the field listed on this screen. The hope is that by doing this, we could align various efforts across the state and use those disparate efforts, or different, a school district using one program and another district using another, probably still have common lessons that they could share with one another about how to engage their faculty in that process, or how to engage the families and their community in that process. So working towards that effort of alignment. And this allowed us, I'll say it did allow us to do this, but ultimately our goal was to provide recommendations to the superintendent of public instruction for the state of Idaho on how the State Department of Education could help support these efforts in our schools. So starting in about February of last year, we reached out to I started with about a dozen folks and asked if they would be interested in continuing this conversation with me, continuing the work with me. And what ultimately happened was a snowballing sample of so many people who wanted to be involved and so many people who needed to be involved. And so, although sometimes when you have a very large group, it can be messy, we put together a group of about 90 individuals with about 70 to 75 who actively participated in each engagement. And they included parents, teachers, school counselors, psychologists, social workers, school administrators. We had state agency representatives, tribal representatives, school board members. We even had post-secondary representatives, both from a service side of behavioral health and wellness and also the academic side, those that help prepare school psychologists and school counselors for their work. They were all involved, and also clinical providers. So folks who are in the field providing this service outside of schools were involved in these discussions. Again, Education Northwest, the same organization that helped us manage the survey, helped facilitate those meetings and organize those events and help with agendas. We met, I think, 4 times and then met again kind of virtually to review and finally approve a set of recommendations in July to the superintendent of public instruction. The idea was that we would use these recommendations to build an action plan or a work plan to ensure that we could get the support, resources, training, technical assistance, and leadership out to our local districts. And again, it's really important to focus on those things because that is the role of the State Department of Education, is to help support our schools to become the best version of what they want to be, not necessarily to tell them what to do or how to do it. So Laura, I saw that you were going to jump in.
Eric, the fact you got 90 people together and had 4 meetings and went from nothing to recommendations between February and July, that might be a land speed record. That's, I mean, that was quick. And it was a lot of information that was passed to those people, I mean, on the group. It wasn't, those meetings weren't fluff. It was a lot of content, a lot of questions, but the thing I appreciated the most was a lot of listening.
Well, and that's what I was about to say is, for me, in my role at the State Department of Education, I need to meet the districts where they are and understand the needs of students. And sitting in an office in Boise, not in a classroom on a daily basis, I feel quite removed from that. And getting these people in their room, they were the experts. And so much of our meeting focused on a sharing of information. So people that were part of the committee could request to present to the group and share information. And that was a really valuable opportunity because it took the many experts that we have in this field and gave them the opportunity to provide input to the recommendations that ultimately we did submit, and that by and large were supported by the superintendent of public instruction. So from July through October, the State Department of Education convened a working group of SDE employees. There were also some folks who participated from some other outside agencies, such as the Office of Drug Policy and the Department of Juvenile Justice that were involved in this. And over those couple months, we put together a set of actions or activities, planned work. So this is a work plan really for me and my department. So as far as who will ensure that the things on this plan get done, you can point the finger, I think, first back to me, but there will be a team of folks from the State Department of Education who will serve as lead on various projects. I'll still be involved. And then you'll also notice on the work plan, there's a column that talks about partners. And those partners are really just the primary partners we've identified, but not an exclusive list of who we plan to include. Not all, but many of these actions that we'll discuss will have work groups that come back together to guide the work as we implement that into practice. So one of them is our website. As an example, you'll see it. We will have an opportunity, or our intent is to create a website that both focuses on school support, but also family and student support. And so we will want parents involved in both ends of that to help us understand how that information is viewed and the lens they bring to the table. Same with classroom teachers versus administrators, they bring different lenses. So making sure we continue and we don't stop the collaborative work and just put our head in the sand and focus on getting it done. We do plan to keep the collaboration as we move forward, but those listed partners will be key in these particular activities associated with it. The
So
last
with that,
column.
let's make sure let's dive into it. I mean, like you're telling us about, I feel like you're teasing us, Eric. There's all these
I
things to
was.
look at.
I was trying to. The last column on the right, you'll see for each activity is sort of the evidence that will determine whether or not we were successful in completing that task. So the way we have done this is I'm going to introduce you to each of the recommendations, and then below the recommendation, you will see the activities to date that we have identified to help support that recommendation. So the first recommendation was to improve access to data that informs districts on outcomes to monitor the well-being of students in school climate.
So I want to start by saying this list is, from a parent side, does not feel like a sexy list of awesome things that we're going to see like show up in our kids' classrooms tomorrow. And so as a parent, it's hard to see a lot of work getting done where we're not seeing any tangible results on the other side. So I want to make sure we point out two things. First of all, let's go back to local control. Every district gets to decide what to do with this information and this support from the State Department of Ed. And second is there's a whole bunch of stuff that is not super exciting that sits underneath as a structure for what we're about to do statewide. And that has to happen for anything in the future to be successful. And so some of this stuff like improve access to data, most parents aren't running around, in their kitchens going, ooh, more data. But the programs that we want to see in our schools don't happen without it. So as we go through this list, I would just encourage our parents specifically to look at these recommendations as that framework, that foundation that we need to see this meaningful change that we know is coming. But the recommendations from your stakeholders, the experience was so vast and so wide that I'm grateful that they noticed that none of these amazing ideas that we have are going to be useful if we don't have this first. And so, I will actually make sure that I'm very excited that we have the foundation as our original recommendations and not, oh gosh, we stood up a bright and shiny thing and now we can't do it because we don't have what we need to support it. So yay for the first things being first.
Definitely this is groundwork. And, a great example of this first one, which is to enhance statewide data analysis tools to look at the impact of these programs. A great example is our bullying data in the state. Our bullying data is housed in a different location in terms of the database compared to where we house information about attendance. So if an administrator wanted to look at the correlation between attendance and bullying, it would be something that they essentially couldn't easily do. They would have to pull data from various places. And that's true with a lot of our data. And so the goal here is to try to get those data sets that are stored in different areas and provide our administrators an analysis tool where they can track things in their district across data sets that make sense to compare, but right now are very difficult because of the fact of how the data is stored. So Sammy, I know you did some information on school bullying, and I don't want to speak for you, but I will say I think what you found is that it varies so much, again, district to district.
Right. The bullying numbers reported are insanely low. I would say, if I'm recalling this year, there were 20 instances of bullying reported in West Ada, which is a 40,000 student district. So, but that specific data set aside, I would say that making it easier for districts to access this kind of data goes back to a point we were talking about earlier when it comes to evaluating their programs, right? If you have this data, you can say, we want to see this kind of change in the data. Let's evaluate how well our interventions are working for students.
Sammy did a great article on bullying and the data. And what I like about it and how it relates to this is, at the district level, it's often a different staff member that's reporting to the state the instances of bullying versus the person that's submitting data on attendance. And so, by getting that data in a place where districts can compare their data all at once, hopefully they'll see errors or issues in that data. For example, West Ada, with their number of bullying instances, someone who's reporting their behavioral issues in the school outside of bullying might see that and say, wow, that's striking. We should look into that. So making sure that data is available.
And I think also a lot of these things, unless there is a mandate to report them a specific way, our districts are holding on to their information in different systems, sometimes at the school level, not even at the district level if it's not required, or who does the reporting and what process they need to do it, and how that data is getting from where it started to where it ends up being reported out. That path can vary quite a bit from who touches it, who vets it, does this meet the criteria, does this not meet the criteria. And so I think when we have improved access and we have better databases, and so we're more consistent, we also improve the quality of the original input data. And if a district or a school knows that they're going to have to report out on what's going on, and it's going to go into a system, and someone's going to look at it and go, wait a minute, why do you have this over here, but that doesn't match, what we expect over here. It starts a conversation. It's not a finger pointing issue. It's a conversation like, oh, are we counting all the things? Who's got these numbers? I know in our district, they realized that a lot of the reports of data were being taken on paper. And some of the schools were doing great. Like if there were 2 students involved in that document, then that it was being photocopied, and one was going in one file and one was going into another, with maybe a third copy going into a master file. Other districts were like, oh, look, it's the end of the year and we've got a stack of papers. Okay. and it's not that there was, it's just, we're done with these papers. So just something as simple as improving how we report it and how we access the data changes the ability to track trends or the ability to intervene if an intervention is necessary. So I am excited about this, though it is not probably what I will put in my Christmas card this year about exciting things that happened.
And I don't want to spend too much, I will try not to spend too much time on each of these activities, but Sammy mentioned earlier that for many districts, it's the cost of building that prevents a district from doing analysis. And so when we put these data elements together, the goal is that we would have built-in reports districts could run that would compare data so that that work is done for them. And hopefully that will make them more likely to use the data that's available. So.
Oops, I jumped. It jumped. There it goes. Back.
Oh, would you go back one and at least let me hit one more?
Okay.
We have a couple activities. I want to talk about data not currently collected on school climate and possible means for data collection. And this
okay, so first of all, explain what school climate is. Is my kid having a snowstorm while I'm at the beach? What does it mean by school climate?
So school climate to me really talks and focuses on what you said was missing from those evaluations of our programs. It really tries to get to understanding the culture of a school. And so it would ask students about, how comfortable they felt with approaching an adult and asking for help in a school setting. It would ask them about their interpersonal relationships. It would ask them about even the physical, are there places in the building where you don't feel safe and why? So it really dives deeper than many of the evaluations or surveys that we ask of kids. It's really intended to inform the local school.
So not having a snowstorm at the school while I'm at the beach. Okay, I'm glad we got that cleared up.
So recommendation 2 was to improve access to referral-based outside behavioral health and wellness services. For me, this is one that I felt very passionate about as a parent myself with 2 teenagers, one in high school now and one in middle school. And living in a very populous area of our state, I struggled to connect my children to behavioral health and mental health resources. And I know if I'm struggling, then I have to imagine there are a lot of other parents struggling as well, who may live in areas where they don't have access as readily as we do here in the Treasure Valley.
And I
So
think
a
if you're a parent who has just found out that your kid has an issue, that it's big enough that it's touching school, and someone at school says, hey, you need to get that looked into, you need to get help with that. What does that even mean to a brand new parent who hasn't had to deal with this before? It's a very overwhelming subject, because to us, we have a problem at school, and oh, by the way, you need to go get help for it. Go forth and do that. And it's not necessarily a straight line from one to the other. So having our school say, hey, this is what we're seeing, here's some options for you, it takes that initial feeling of overwhelm and gives us an action step, which is huge. I think a lot of our, I know that the feedback we get from teenagers frequently is that their parents, when they go to them directly and say, hey, I think I'd like to, deal with this thing. And we have teenagers who said their parents' response is, well, you're being a drama queen or a drama king. We don't have those kinds of problems in our home. And they stop. It's a dead stop. But if the school says, hey, we're seeing some behaviors and here's some ways we think, you can get some support, that's a different conversation, a different lens, and also a different likelihood that the child will have access to that care. And so under the ones that are groundwork, this seemed like it was obvious, but it actually is not happening in most parts of the state. So I'm very excited this one's on the list.
And thanks, Laura. And 2 programs that we are implementing in our state, and it is, well, I'll speak first to the AWARE grant. The AWARE grant is a pilot project within 3 districts. And I only say pilot in the sense is not statewide. This isn't something new we're trying necessarily. The practices and services that we're providing are best practices that have research evidence behind them as why they should be done. But it's pilot in the sense that it's limited due to funding. And so we received funding to support 3 districts to include a behavioral health and wellness services provider on site within that school. And that I will say each of these programs include a strong element of evaluation. And we're too early in this project to know the effectiveness, but very excited to be able to share out. The other one is the Garrett Lee Smith project. And this is one that's aimed at preventing youth suicide. And this one is statewide in that we have placed a grant-funded position in each of the 7 health districts to help students and families that have been out of school due to a mental health illness with a transition back into the school system. And so those folks are available to support the entire state of Idaho. And so I'm very excited to also evaluate the effectiveness and hope that these both will lead to changes in how we support our schools.
And that's something I think that very few parents even know exist. I know that my school district, when my son was transitioning back from an out-of-home mental health placement, said, if we don't know 2 months ahead when he's coming home so we can start our planning, we're behind. And I was just so grateful. That transition team had, I think, over 15 people from the district just to make sure his reentry was successful. And it was. But I don't think most families even think about the school reintegration when they're worried about getting a kid home and getting psychiatric services in the community. So that's huge. And I think it's something that families don't know exists. So yay.
Yeah, and I agree. And that you'll see, I think that an area of improvement for the State Department is communication and access to information is an area we could improve upon.
So where can we find information about that awesomeness?
Right.
Well, like right now, if I had a parent who called me, how would I track it down, Eric? How?
My contact information is at the end of the slideshow. You can call my cell phone. No, really, some of this information is available. This specifically is available on our Idaho Lives project website. Idaho Lives is the terminology of the program, or the title of the program that we give to working to end youth suicide ideation and prevent death by suicide in our youth. So that information is available, but what we don't have is a page at the State Department dedicated to behavioral health and wellness, where all this information could be collected.
So we'll put that information on the Idaho Parent Network website after the conference.
That would be great. The other activity there is community schools, and that is something that we're partnering with Blue Cross Foundation with. And these are really, Marsing community is a great example of where this has been done. And basically they have used the school and their physical building as a hub to give access to parents for a variety of medical services, everything from dental visits to mental health counseling. There are districts that are using their school buildings to support their community in that way. So that is an option some of our schools are picking up and supporting. The next recommendation, 3, is increased support for schools and districts in the planning, implementation, and evaluation of services. Again, as we talked about as we went through the slideshow, implementation, planning, and evaluation are often the pieces that go to the wayside when sufficient time and funding is not available. And so we're trying to bring in a community of support that will be led by the Comprehensive Center, which is a technical assistance center for school districts, and basically take lessons learned from schools of similar communities and help support these efforts in both planning, implementation, and evaluation.
I love the fact that this is assisting our districts with the heavy lifting part. The stuff that happens behind the curtain that families don't necessarily appreciate, staff doesn't necessarily appreciate, but someone in a district office somewhere gets to do a lot of, and then gets to task it out to someone. That this takes a lot of the guesswork out of it. And I appreciate that goal for this. Sammy, is this something that, I mean, you said that that's what you were seeing, that this is the part that they're struggling with. Is this something you think that districts across the state are going to take a deep breath on, or are they going to be like, yeah, I don't know. What is your thought?
I have never met an educator that didn't love the professional learning community. So I think that they will always be excited to get to engage with other people who are doing this kind of work and learn from one another. And I think when you talk to districts in Idaho that are really engaged with behavioral health and wellness, you know, I'm thinking Nampa and Coeur d'Alene, they're very familiar with one another already. They talk about what they're doing and try and find common ground. So I think it will be very beneficial for districts that are just getting their feet wet in this to learn from those other districts that have a lot of experience.
So it's partly my fault, but we have a lot more slides and only 17 more minutes. So I'm going to have to flip to the next slide, Eric. Are you going to be okay?
Absolutely. Okay,
because you have, I mean, you could tell us all sorts of great things. So I'm jumping. Some of the slides are shorter, so that we might make up some time.
No worries. I appreciate you keeping me on track. So our 4th recommendation was increase awareness and access for Idaho public school employee mental health resources. And this one just generally is an area we don't have many activities, and in part it's due to, I guess, the focus. You know, when we started the collaboration, it was focused on how to best serve students and families. But in that process, we need to address the mental health and wellness of our teachers and our administrators and make sure that they have access to those resources. And so this is an area I need to identify or explore more. And I think we'll likely see a more defined activity. But right now, generally, our goal is to enhance and increase communication of those existing resources for those folks. Recommendation area 5 is identify, support, and provide ongoing trainings and best practices related to student behavioral health and well-being. And this may seem very generic, but there is a list of trainings that we took notes furiously as various districts reported out during our workshops, our meetings, on what they were doing. Everything from trauma-informed care, adverse childhood experiences, PBIS, the positive behavior intervention and supports. These are all different programs. And currently at the State Department of Education, we do not provide a list of what are considered to be evidence-based best practices. And so that's something we look to do for the districts. The next one is to increase the involvement of youth voice in how we message and communicate resources and supports. So timely, go ahead.
I was going to say, I thought it was funny. I was sitting in a meeting with some teenagers who were having the opportunity to have their voice heard at the district level. And the conversation was as simple as, we need to put up posters so that, you know, to give our middle and high school students some information about a specific subject. And you know, the adults were like, oh, well, we're going to do this, or we're going to do this, we're going to do this, you know, they're going through the list. And finally our teenagers spoke up and they're like, put it on the ceiling. And everyone was like, what? They're like, well, if I see something on the ceiling, I'm going to go, what's that? And I'm going to look at it. Or put it at the top and don't make it straight. Like make it look like someone accidentally stuck it at the top of the wall. If you can't put it on the ceiling, don't put it in places I'm going to expect to see a poster. She said, and you know, the girls that were in there said, boring adults, line it up, make it pretty, make it square and equal from sides and perfectly. No, I don't read things adults want me to read. I read things teenagers want me to read. And I had to laugh because something as simple as we had gone through this entire process to create a program for the youth, and the youth are like, we're not going to read your information, but put it on the ceiling and we will. And I mean, something that simple, I mean, I don't think a single adult in the room would have thought to put it on the ceiling if we wanted their attention. So I love the fact that we are looking at youth voice in how we're going to message this. One other thing that youth have told me working in this, you know, working with behavioral health is, I don't have a crisis. I've never had a crisis. Other people have crises. I don't have a crisis. I can handle it. I'll be fine, but my friend might be in crisis. And so how do we message these programs so that they don't tune us out because it doesn't apply to them? So I'm
really
looking forward
good
to see what they
comments,
say.
and I think that really captures our activities, putting together a group of students and having them help us in delivering our messages and crafting that. So
Sammy, I know that you've interviewed lots of kids around the state as part of your work. What are your thoughts?
I mean, I'm excited to hear their ideas. I think students always have great ideas. You know, I don't want to get too nitty gritty, but I'm thinking about one student, you know, one of our most common supports for students is providing in-school counseling. And I remember an interview with a student in Nampa who had used that service for 4 years. And he said, every year I have a new counselor and I can't build a relationship with them, that there's such high turnover that I have to explain my issues over and over and over again. And I don't kind of get that longevity of support. And that's something that really stuck with me. So I think asking the kids for their feedback on existing programs is really important too.
I would agree. Okay, what do we got?
the next one is develop online resources. As I said before, the idea is that it would support not just districts and schools, but also teachers, students, and families. And so we will be doing that in the year ahead. And we'll also be doing this as it relates to Title IX, which Title IX is the protection against sexual violence or sexual harassment. And this is something that was new to education about a year ago. So making sure that we update our slides so that our schools understand, or our website, so our schools have access to the most current information, resources, and training.
And I think one of the things that's going to be important to families is that while the State Department of Ed directly serves these districts who then serve their schools, when parents want this information, the wealth of knowledge that comes from the State Department of Ed is impressive. but it's also very overwhelming when we open the website if we don't know what we're looking for. And so finding a way to communicate this material in a way that doesn't cause the person accessing it anxiety. I mean, the irony there. So we just need to make sure that the website and the access points to the website are friendly for the audience and what they're trying to get. I don't want a list of staff trainings when I look it up, because that's not what I'm trying to look for. I'm looking for, how do I help my kid in the school system? And how do I get that without sifting through a whole bunch of technical words that I may not understand? We don't want families and youth to turn it off because they're not sure what they're looking at. So I trust that you will have plenty of feedback, but that is important
I
to
agree.
us as families.
A great example of that is Title IX is probably an appropriate title for the school and administrator page. It's probably not an appropriate title for parents and their students who may not recognize their situation as Title IX.
You know, I had someone, I saw a form once where they were asking kids about bullying, and they said, you know, was it a student or a staff member that bullied you? And if you said staff, they said, so was it a, was this person certified staff or not certified? And I was like, certified to do what? Like, are we talking about teacher certification? Or, I mean, are they certifiable? I mean, but how would a parent even walking into the building know when an adult is certified staff or not? Do they have a sign on their head? Do they wear a different color shirt? I mean, no kid is going to be able to answer that question. Most parents won't either. And so we asked them to please delete the question from the form, because the kid would stop answering the whole form because they can't get past that question. They won't just skip it and move on. They're like, this is not a form for me. And they walk away. So anyway.
That's a great example. Exactly.
And by the way, I still don't know what a certified staff is. I'm just going to say, I still don't know.
I can fill you in later.
Okay, well, offline, we'll do it.
The next one is identify barriers and supports to increase the school pupil personnel pipelines. And there's a couple things here. One is working with the rural districts to see if we can pool resources. But I think one of the biggest ones here is collecting accurate or data that accurately reflects our situation. Currently, our data counts part-time employees as essentially full-time positions. So any position, whether it's 0.25, 0.5, 0.75, is counted as a 1 when we do our numbers, which obviously skews the ratios of the number of counselors we have to support students in schools. And so hoping to improve on that.
And to break that down really quick, pupil personnel is psychologists, counselors, social workers.
Right.
Nurses, I think, maybe are also
Yes.
in there. But
Okay.
The next one is support Idaho Association of School Resource Officers. And here, basically, there is an Idaho Association of School Resource Officers. They've struggled to get established in our state, and our hope is to help them get established because one of their primary missions is to ensure that any school resource officer has been trained as a school resource officer. And this is not always the case. And so really hoping to increase the training for school resource officers beyond what they receive in the peace officer standards and training that they go through to be a police officer. Which
has the downstream effect of them working better with their school districts because they know, what lane they're in, and they can help work with the districts and the schools individually to be in the right place at the right time. They don't need to be in all situations, but I think that far more frequently than they are included, they need to be, especially when we look at bullying that tips itself over into, stuff that, criminal activity. And so I'm excited about this one just so that they have some consistent support.
Yep. And I heard from IASRO that, the biggest challenge is the officers often come in if they haven't had training thinking that their primary duty is enforcement. And they soon realize that really it's about community building. And so being trained on how to do that and do it effectively in partnership with the school.
Yes, definitely. So we're going to get through this one because I think the last one is the one we need to have the most conversation about. And we have a whole 6 minutes. So let's do it.
The next one is to help increase the training for school-based mental health professionals. And this is something that we're doing in partnership with You'll notice all the acronyms listed. That's the Idaho School Counselor Association, School Social Work Association, School Psychologist Association, and then again, the grant project, Idaho Aware. So we're partnering to provide workshops, conferences, and trainings for this group.
Okay, so, oh, whoa, it just decided it was done. I don't know what that was all about. All right, well, apparently it is refusing to actually let us see the recommendation, but I'll read it to you. The slideshow is just hiding it.
No worries.
It says adopt CASEL, which is Collaborative for Academic, Social, and Emotional Learning, as a framework for SEL in Idaho's State Department of Education. And for reference, CASEL defines social emotional learning as an integral part of education and human development. SEL is the process through which all young people and adults acquire and apply knowledge, skills, and attitudes to develop healthy identities, manage emotions, and achieve personal and collective goals, feel and show empathy for others, establish and maintain supportive relationships, and make responsible and caring decisions. And the reason this one does not have a fancy table like the other ones is because we have to look at what the research is telling us on that one. And that is this. How do we feel about the Fordham report? What are our takeaways? Sammy, I think I'd like you to speak to this because you are way involved in all of this, and Eric is too, but let's see what your thoughts are.
I mean, essentially, so if this wasn't clear, the recommendation to adopt CASEL is not happening at the moment. It was the one of the 11 recommendations that wasn't immediately approved, or maybe was approved in the beginning, but it's not being acted on at the moment. And I think, Dr. Studebaker points to some of this research that shows that term is not popular with parents. But I also think we have to think about the broader political spectrum right now, where the term SEL is really being roped into conversations about critical race theory, and really getting conflated with that term. So we're seeing pushback on the idea of SEL at the local district level and also at the state level.
And I think it's important to know as parents, like if I could jump up and down and get all of the parents to listen to me all at the same time, it would be that what we're trying to accomplish in the state of Idaho is to come up with a way for districts to have a repository of knowledge and some consistency and how they approach this type of learning to their students, the structural support, and also, here's what everyone else is doing. Here's just some support in implementation and reporting. And we're really talking about those skills that our kids need that research is telling us help reduce rates of suicide, help reduce rates of depression, help reduce bullying and aggression and all the other things that we're saying we don't want. And the data at the beginning of the presentation said that all of our districts with 95% plus agreement say that's an important part of what we need to be teaching. And right now, it's not that we don't want to do that. It's that we don't have a framework for language that we can all agree on has the same meaning. And,
one important thing in the Fordham report that I didn't point out is that parents generally agree that students should be learning SEL skills. There's widespread agreement for, we want our kids to learn relationship building skills. It's really the name of what you call that. That's the flashpoint, I think, is how some folks at the SDE have put it.
So we have a dictionary problem right now, is what I'm hearing. It's just how we need to make sure we all define our words the right way. And I think one of the things that I really appreciate Dr. Studebaker for having to do is walk that fine line between knowing we need to do it and finding a way that everyone can agree that what we're doing is the right thing to do. And words have meaning and they have power. And somehow social emotional learning has managed to have a bad reputation as a title, but not as the actual activities that go into it. So maybe we have a naming contest. What do you think? But as parents, I think it's important that our districts and our legislators hear from us. They hear that these things are important because it's not just the name we call it, it's also the funding to make it happen. I think funding was one of the biggest barriers on that list. So it's making sure we have that ability, because no matter what we call this, and right now we're calling it Okay, go through. Dr. Studebaker, it's the Behavioral Health and Wellness Services. Is that what we're calling it? Okay, I will
Yes.
remember this. But when we're looking at behavioral health and wellness services, that parents support it. We want our districts to know that. We want our legislators to know that. That's something you can choose to do on your own, but that needs to happen because Idaho is moving, tiptoeing in the right direction. And I think that this work that was done by the State Department of Ed gives us so much so much to go in that right direction. I want to make sure I put the slide up there so those who wanted to see your contact information and have your cell number in their back pocket, they had that opportunity. Dr. Studebaker, I know we're at time, but we have a couple minutes. If you would like to give us any parting thoughts. You did an awful lot of work. You were in charge of a huge group of people who got a lot of things done. Sammy has been asking questions about this across the state for a long time. And so she has been able to hear kind of how people feel about it. And as a parent, I was grateful that I got asked to be part of those meetings and to kind of peek behind the curtain. I want to make sure everyone understands how much work you've put into this. This is huge. And to have you've done a great job and getting us this far on a subject that people aren't even sure about. That's impressive. Gold star, gold star.
Well, thank you. And thank you to Sammy. She has done a lot of work that I can't do. And she continues to keep this issue front and center. As a parent myself, for me and my kids, this is an area I really think schools need to improve upon because I am concerned about my kids' emotional, mental health and well-being. And it's difficult right now to understand where our students are. And it's potentially even harder to connect them with resources. And those are things I think we can improve upon for our parents. So they have clear expectations. They know how to navigate if they have a situation. So I give my cell phone number out because I expect people to use it, and you're welcome to call me before or after regular work hours. I'm passionate about this topic. I'm passionate about doing my job well, and any criticism to me is an opportunity to improve. So I'm all ears if you ever want to call and visit.
And a resource that Sammy has available for us, and we'll put a link on the website, is she has really been digging into how districts are using their resources in this regard. And it's interesting. I haven't had a chance to look through all of it, but it's a wealth of knowledge that I wouldn't have time to put together. So we'll make sure we add a link to that as well on the website. But that allows us to look up our districts and see what they're doing.
Yeah, and keep an eye out for Idaho Education News. I'll be going through how districts are adding more services this year because of a wealth of new federal funds, and I'll break that down hopefully in a digestible way. So that should be coming in the next few weeks.
It's a lot of information. So thank you guys. I can't tell you how much I appreciate being willing to have this conversation. I know that this, as I said, data collection analysis is not a sexy topic all the time, but it is such a key to us making the progress that as parents we know we need to make in our schools. So thank you for this. And
thank you, Laura, for making this possible and for getting this out to folks. Thank you.
I'm grateful for everyone who's willing to do the work. And Sammy, thank you very much for being the person who's asking all the questions statewide, because I don't have time for that. And they're the questions I wanted answers to. So thank you guys. And we will see you guys in the next Parent Network session tomorrow. Bye-bye.